Ladies and gentlemen, colleagues and friends, welcome to the webinar on post-COVID-19. How can countries of the Global South work together to strengthen global and national health systems around maternal and child health? This webinar is a collaboration of 4 UN entities: UNICEF, UNFPA, PAHO WHO, and UN Office for South-South Cooperation. My name is Grace Wang. I'm the Deputy Director of UN Office for South-South Cooperation. As all agencies collectively decide to give the stage to the speakers they recommended and invited us to moderate on their behalf, I feel both humbled and very delighted to be a moderator today. Before we formally start, let me first extend our warmest welcome to our distinguished guest, Her Excellency, Dr. Margarita Cedeno Lizardo, Vice President of the Dominican Republic. We're very honored to have you with us today. Some housekeeping matters first. Please also be noted that this webinar will be recorded and shared on the South-South Galaxy platform and other platforms of the co-organizer agencies. In order to manage time and smooth flow, we will not take live questions from the participants, but you are encouraged to make use of the chat function to engage with the panelists. And we will later on have a question and answer session to help you pass on your questions to the panel. Colleagues and friends, rights to life is a fundamental human right, and the maternal health and child health is at the heart of SDG 3 on good health and well-being. Although progress has been made, achieving the SDG targets remains a major international challenge. WHO reports that every year, over 300,000 women die due to preventable causes during pregnancy. Under 5 mortality rate, although already significantly reduced from 2020's number, 70 per thousand live births, to 39 per thousand in 2018, but this still represents to us a huge gap before we can arrive to our ambitious goal of SDGs. With the impact of COVID-19, we can potentially see those efforts need to be doubled to improve the progress because of the health system strained responding to the pandemic. However, we also are encouraged that many countries have already prioritized the maternal and child health in their COVID-19 responses and in their preparation for recovery. Today, we will be able to hear experiences from many of those countries, but also to listen to them, their perspectives and their expectations from the Global South. How can countries work together? How can UN system better facilitate and support countries working together to form solidarity, collaboration, and collective solution to this global challenge? Now, without overdue, I would like to welcome Mr. Jorge, Director of UN Office for South-South Cooperation and Envoy of the UN Secretary General on South-South Cooperation, to provide opening remarks. Mr. Chediak, the floor is yours.
Thank you very much, Grace. First, let me tell you that this is a very important event because we have been undertaking a series of seminars or webinars like this to highlight different elements of response to the COVID crisis in the Global South, and also to promote exchanges among countries from the Global South on how to respond to the pandemic and also how to build back better, as our Secretary General says. So let me start in this case by welcoming the distinguished participants, high-level speakers we have today from the Dominican Republic and Tajikistan, Sudan, Nigeria, and China. and also welcome the youth champion, Ms. Michelle Belfort from Suriname. Also, this is an interagency initiative, as Grace pointed out, and I want to really thank the partnership from UNICEF, UNFPA, and PAHO, the Pan American Health Organization, to put together this joint event. And this is a critical issue that we are going to discuss: maternal health, reproductive health, early childhood health. On one hand, one of the laggards in terms of achievement of the old Millennium Development Goals was maternal health. It was one of the global objectives that we did not achieve. And since then, since 2015, we were making good progress, but that progress is certainly threatened by the pandemic, threatened by the health effects on the health system, as many health care resources have to be diverted to respond to the pandemic, and also because of the socioeconomic effects that the pandemic is having in many countries as a result of the closing down, in many cases, of the economic activity. So therefore, we have to find a way to minimize the problems that the pandemic is causing to maternal health, reproductive health, and early childhood health, and also to prepare the return, the post-pandemic, in a way that we can capitalize on the experiences and accelerate the progress. And we have to do it because for the first time since the Human Development Indicator has been put in place in 1990, 2020 will be the first year where at the end of the year, human development at the global level will be lower than it was before. There is a study by the Lancet that was published recently, and it predicts that because of COVID, we're going to have over 253,000 additional child deaths. And let's think of that for a minute. It's almost 800 children a day that are dying because of the consequences of COVID, not directly from COVID, but because of the diversion in the health systems, and also because of the socioeconomic consequences, and 12,200 additional maternal deaths in only 6 months across 118 countries. So this is having very real consequences. At the same time, there are good practices. That's why we're here, to showcase the ones that are your countries, your organizations are putting together. There are good examples of, beyond the panel today, that from Pakistan, the joint efforts from the African Union and the Center for Disease Control of Africa, etc. So there is a new commitment also from the UN system to promote increased South-South cooperation. Last year, we had a conference that established a mandate that the UN system has to engage more strongly and substantively in supporting cooperation among developing countries. And I'm very pleased to say that UNFPA, UNICEF, and PAHO are strongly committed. And we look forward to having this event as a space where we can share good practices. And as Grace said in her introduction, we commit institutionally to support your efforts at the national level, and also your efforts and your contributions to exchanges of information and good practices throughout the Global South. So thank you very much. We're very pleased to be part of this initiative as an office. And without further ado, I give the floor back to Grace as moderator to start the panel. Thank you very much.
Thank you very much, Mr. Shediak. Now we have the distinguished panel to talk about their experiences. Also, what do countries in the Global South expect from the UN system and specific UN agencies in supporting member states in achieving the SDGs post-COVID-19? How could UN support countries in strengthening their health systems, especially on maternal and child health? And how may countries, with facilitation of UN, leverage South-South cooperation and triangular cooperation in strengthening their health system to achieve the goals? So each panelist will have 7 minutes so that we can leave empty space for interaction. Our distinguished panel has very graciously offered the first slot to our young advocate and champion, Ms. Michelle Belfoto from Suriname, who will share efforts and perspectives on to reduce maternal and child mortality level in her own country. Michelle, at 22 years old, already influencing people around her together with her friends, colleagues, and to become more socially active. She has represented Suriname for the first time in the Women Deliver Young Leaders class of 2018. Currently, she is the regional coordinator for Latin America and the Caribbean for the International Youth Federation and coordinates the UN 75 campaign for the United Nations in her country. So Michelle, the floor is yours.
Thank you so much, Grace. Thank you, Mr. Jorge. I'm honored to be among such high-level speaking panelists. It's really an honor to not only represent my country, but to represent the region as well. And looking at the questions that were raised, it's important for the UN to analyze the social economic impact. The pandemic started as a health crisis, but what we're seeing is that COVID-19, this pandemic has had an impact on access to sexual reproductive health services, access on our has had an influence on our education system as well. And these are very concerning because we need to analyze what the impact has been for the different layers of society with the pandemic in order to prepare a social economic response as a UN. And it's important to capture all voices of everyone everywhere in this society, which is also what the UN 75 campaign is doing. And it's depending on countries, on the support of the UN, with it on a country level, on a regional level as well, to come together and work on a holistic approach for this social economic response. One thing we have noticed is that COVID-19 has let us see the weaknesses in our system. We have seen that what has been clear for now is that within the Caribbean, within Latin America, when it comes to technology and education, this has been an issue, especially for our young people. We have young people at home that need to do long distance learning, and it's not working because we don't have the technology measures in place or the capacity in place, the different mechanisms to exercise this. And now that we have seen the weaknesses, we can come together as a country with the support of the UN to see how we can best tackle this issue. And the power of the UN, especially for South-South cooperation, is to bring people together, to convene and harvest this knowledge. Because as a country, we may be weak or we may not have the needed resources to tackle this issue or come up with a social economic response. But as a region, we definitely can, because even looking at specifically Latin America and the Caribbean, what we're seeing is that maybe in Suriname, we do not have the capacity or the human resources, but we do have top universities in the region that have been through recess and do have the knowledge on how to tackle these issues. Looking at people who have participated and have been part of the Ebola pandemic and have been part of the team to help recover. And we should leverage this. And the UN has a great power of bringing knowledge together to facilitate not only in a technical way, with human resources, but also it goes further than that. It's also advocating for important issues such as maternal health, that is important, access to sexual reproductive health and rights. Aside from that, what we're seeing is that looking specifically at maternal health and sexual reproductive health and rights, we will need specific agencies such as UNFPA, such as the PAHO, such as UNICEF, to raise their voice and let governments know that the pandemic also has an influence on young people, especially young people, the most vulnerable among us. Because this pandemic, it raises so many economic issues in food security and safety that seems to be a main focus across countries that we're seeing in Latin America and the Caribbean, also in Suriname. But it is important to still think of the maternal health, to still think of the 10-year-old girl, to still think of access to sexual reproductive health and rights, because on the long run, this will have an impact on your economy as well. And to use their power to advocate and help push these items on the agenda, to let them know that the power of the 10-year-old girl or the 10-year-old girl will still have the age of, will still be at the forefront of achieving the new framework in 2030, and she will be the one where the economy will rely on. So we need to strengthen her now more than ever. Aside from that, to build back better, there's a scale of opportunities that we're seeing right now. When we're looking at maternal health, this was an issue even before the pandemic. This was an issue even before the pandemic in achieving SDG number 3. So what we now need to do is we have seen the weaknesses, and we need to come together. Like even when the SDGs were created, we need to come together a moment like that and come together as a world, as countries, as a region, as a world, and think of new innovative ways on how we can tackle these issues. What we have seen during the pandemic is that opportunities have arisen. Services have been made available in the most creative ways. We've seen that technology is important. We've also seen that people who normally did not have access to sexual reproductive health services could now just click online and find these services. And then I'm talking about people in the interior or the hinterland. This was not available before. We need to learn from these opportunities and harvest them and move forward. We can do two things. We can go back and weaken our system, or we can come out stronger. One thing is clear: there are opportunities. We need to leverage this, and we need to move forward. And we need specific agencies, especially the UNFPA right now is one of the most important ones, together with the PAHO, and of course the coordination for South-South for knowledge sharing. But we'll need a one UN approach to tackle this issue, because to have a socio-economic response, we need all layers of society. We need to measure the impact. We need to give everyone a voice, and we need to amplify their voices. And for that, we will be needing UNICEF, we will be needing UNDP to connect with the people from the hinterland, the most vulnerable groups that are almost not seen in our society. And that is one thing we need to measure. We need to also be cautious that we're not creating a pandemic within a pandemic. And that is something that all of us should be aware of, and that the UN can advocate to our government system and make them aware of these vulnerable groups within our society and the potential they have. Not only looking at the access to sexual reproductive health, but also looking to them as an economic benefit, to harvest the demographic dividend, that investing in these young people right now is more important than ever before. And I think I want to conclude with that being said, and to summarize, just want to highlight that it's first important for the UN to provide support in doing a socio-economic assessment. And with that assessment, it would be a socio-economic response, but not just one in country, because what we have seen is that we don't have borders anymore. COVID-19 started, there wasn't even in the region and wasn't even in our country. And now we have around 200 cases. So we see that there are no borders anymore. And what we now need to do is a call for South-South cooperation, to look at modalities that are also done in northern countries which work, and to copy those models into our own country. For the UN to use their power to convene people and bring knowledge together and facilitate knowledge sharing, but it must also go beyond knowledge sharing. It must also go into facilitating and implementing these strategies not only looking at it as a country approach, but as a region approach, because as a country we'll not come out of this, but as a region, we do have the opportunity. And as a world, with the support of the United Nations, I believe that it is possible. Thank you.
Thank you very much, Michelle, for really a very strong advocating for not creating a pandemic within the pandemic, advocating for this very serious issue, and for putting women and girls, their priorities up front in the center. And thank you very much. I think your expectations of UN to continue to be a convener and also to bring countries together and for specific agencies to put extra support at this time is very important. Thank you very much, Michelle. Colleagues, friends, our distinguished guest, Her Excellency Dr. Lizardo, Vice President of the Dominican Republic, has to regret that she cannot join now as she has been called to another very important meeting urgently. So she has kindly requested Mr. Ezequiel Medina, who is the Director General of the Administration of Social Protection Subsidies. Mr. Medina's career in public administration began at the Directorate of Educational Technology of the Ministry of Education. Education was also a very important element that Michelle was just talking about. And also from 2010 to 2012, he held the Planning and Development Direction of the Solidarity Program. In 2012, he became the Director of the Planning, Monitoring and Evaluation of the Progressing with Solidarity Program. From 2018 to 2020, he was the Interinstitutional Director of Planning of the Vice Presidency of the Dominican Republic. So, Mr. Medina, thank you very much for joining us today, and the floor is yours.
Thank you very much, Ms. Grace. I'm talking on behalf of the Vice President of the Dominican Republic, Dr. Kazakhstan. First of all, let me thank the United Nations Office for South-South Cooperation, UNFPA, UNICEF, and FAO for convening this webinar in a time when reproductive maternal newborn and child health has been profoundly disrupted by the COVID-19 pandemic and threatened the life and livelihood of us all. I would also like to thank my fellow panelists for joining efforts in raising awareness around this important issue. In order to position ourselves, in order to achieve the SDGs, we all, both the UN and member states, should revamp and accelerate our effort across the board. This pandemic is setting us a few years back in terms of the game in public health, education, nutrition, etc. Getting back on track will require new ways of thinking, new ways of delivering technical cooperation, new ways of developing and implementing public policy. And we believe that is where South-South cooperation plays a very important role on the post-COVID world. Thank you.
Thank you very much. Thank you very much, Mr. Medina, for your statement on behalf of the Vice Presidency. We are very honored to have these remarks. And also, we would like to move on to the next panelist. I'm not sure if Mr. Mushinzoda from Tajikistan has joined us at this point of time. If I don't hear, oh yes, okay, great, yeah. Now let me have the honor to introduce Mr. Gaffer Mushinzoda, the first Deputy Minister of Health and Social Protection of the population of Tajikistan. We look forward to hear from you, sir, the experiences in Tajikistan and your expectations of UN's role and UN agencies in working with your countries and others to collaboratively achieve the SDGs, especially addressing women and children health. Thank you. The floor is yours, sir. I think there may be some technical issues. I don't hear Mr. Gaffer's talk. Maybe Shams, can we give some time for technically fixing this, and we move on to the next speaker? We will come back to Mr. Gaffer. Okay. Okay, in this case, if Dr. Sahinas Badri, if you are ready, I would have the honor to introduce Dr. Sahinas Badri. She is the Director General of the National Public Health Laboratory at the Ministry of Health in Sudan, which she has now directing COVID-19 lab testing in the country since mid-March 2020. She's also a practitioner, an associate professor of pathology and lab medicine at Afad University School of Medicine and pathology unit head. She was formerly faculty at Weill Cornell Medicine in Qatar. So Dr. Badri, the floor is yours.
Thank you very much. And I'm honored to be amongst you today. Rather than being a health policy advocate, I am more of a health services practitioner. And I think that during the COVID epidemic, the laboratory has kind of stood out as being one of the strongest and perhaps weakest links in South to South countries. So I'm going to gauge my talk with maternal, child health, neonatal and reproductive services, more geared towards what laboratories, whether in the public health sector, community health, have to offer and how we can work on collaboration with UN organizations. So COVID-19, I don't want to speak about a post-COVID-19 situation, because I think that research has shown us that COVID will be staying with us for quite a bit more, perhaps until the summer of 2021. And rather, we should think about living with COVID post-lockdown situations. It's a complex issues series, and the story all of us are living everywhere in the world. It has had health, wellness, social, and economic impacts. The laboratory for us has been, as I mentioned, one of the strongest and yet weakest links in South to South countries. When we look at maternal and child health services, especially in the Sudan, where I'm from, we often, I'm going to talk about two things. We often look at maternal and child health in terms of numbers, maternal mortality and infant mortalities always. In fact, there are more to these factors. As laboratorians, for example, in the public health laboratory, we have ongoing studies that have been funded actually by UNICEF and UNIFPA, and they look at micronutrients and their impact on health. Now in the COVID era, this opens up new dimensions for us. So also we have to look at how are we going to manage such situations. For example, we have to look at the management and services now. Most primary healthcare centers that we have in the Sudan usually deal with more of a public health, preventive health education tools, health promotion tools, and not really in a curative. They are part of the triage system, but we have them within the towns, villages, etc. So now we have to look at how can we spread our work to them. For example, laboratory services in the municipalities or towns are there to provide services for maternal and child health, but we don't offer screening programs. We leave the health screening programs to more of a tertiary hospital. We now have to think in the post-COVID era, we have to provide these services directly. For example, screening for STDs or screening for breast or uterine cervical cancers can be done at these localities, because we expect that there will be other pandemics coming soon enough or second waves. And so we need to provide the service locally and close by, because people can walk to these centers, okay? So this is from a practical point of view. I'm involved a lot with the work of we have the Federal Ministry of Health and the State Ministry of Health here in Khartoum in terms of how we provide our own services and how we manage them. Management should also include the handling and rehabilitation of some of these health providing centers, but also looking into the health of families. One thing we have noticed now is that we are providing, with the support of some of the UN agencies, a hotline to provide psychiatric and psychotherapy for some of our population. The Sudan has experienced a very strong pandemic of late in the last couple of months. Our death rate has been more than 5%. It goes between 5 to 7%, and our death rate, death number now is over 500, and the population affected is 10,000. This is not completely reflected because we are doing limited testing. This is one of the problems we are experiencing, and what type of testing we use. The lockdown has included also border lockdown, and so delivery of many important items like PPEs to maternity hospitals has been very difficult. The UNFPA has had a good program early on in the pandemic with the Swedish government to provide health education during the COVID era. But we haven't been able to 100% deliver to all centers regionally, especially those providing maternal and health services. So I think capacity building is important in many countries, and approach used has been various. I've noticed it's been various, especially in South to South countries. Some have used a case management approach, as has been used in European countries, and others have used a preventive approach. And in the Sudan, we have tried to use a hybrid situation. So our knowledge is evolving. UN agencies off the bat have been very collaborative, and I must say, for us in the lab, all of the UN agencies have been quite supportive, even though we have had some sort of a chaotic chaos handling this pandemic all over the world. We have now experienced a very good linkage program with South to South countries, and Sudan has always had this progressive view of working with South to South countries. And so I think one of the most important factors as we look into this is communication. we have strong communicators now, but we need more better communication tools, educational tools all over. E-learning, we need to expand on e-learning. We can't stop, the progress of education, whether it's in the elementary, middle school, and high school and university level. So we have to reach students in their homes, perhaps, rather than having them right now, if we're going to experience a second wave, have them come and have overcrowding in some
Появился? Он говорит, соединился? А ну-ка.
So,
Okay, we had a little bit interaction just now. So Dr. Shahina, you have completed your talk? Yes, okay, yeah. So thank you very much for your remarks. And I really think it's so important that we usually hear from policymakers, from advocates, and now this time we're hearing from a practitioner, a medical policymaker, but also practitioner. Your point of how to make sure those basic health services, screening, testing, can reach communities where the vulnerable groups, are, is very important. And talking about South-South cooperation, you have not only be very progressive, but also shared with us some practical challenges in delivering those kind of cooperation during this kind of challenging times. Better educational tools, digital innovation are indeed also very important. And that is a great reminder for us how to advance South-South cooperation post-COVID-19. Thank you very much for your remarks. Now I see Mr. Gaffer already online. So Mr. Gaffer, I have just introduced you to all the participants. And now the floor is yours, Mr. Gaffer. Thank you. You can unmute yourself. Mr. Gaffer, you need to unmute yourself so that we can hear you. Mr. Gaffer, yes. Yes, now please, the floor is yours, Mr. Gaffer. Arasu, I don't think we can hear Mr. Gaffer's talk.
Yeah, he's unmuted. So I don't know why. And
I guess, there may still be some technical issues, and let's give another 1 minute just to try. If not, we can always move on to the next and then come back again. Yeah, I think he is unmute. He's not muted, so probably is, yeah, on his side, either the signal is not strong or the equipment.
Yes. Thank you very much. The Minister of Health and Social, I would like to see in close collaboration. Okay. What about?
Yes, clearly. Thank you. Please.
Yes, exactly. Do you hear? Okay. Sorry. Hello. Do you hear? Okay.
Yes, we can hear you.
I'm the first deputy minister. We have very. Yeah, I hear you. Do you hear me?
Yes, please.
Yeah.
We have already introduced you to the panelists and the participants. Now, Mr. Gaffer, the floor is yours.
Thank you. I'm the first deputy minister of health, and we have very close collaboration with UN agency, USAID, UNICEF, and other UN organizations, and especially during COVID situation, we have good experience to reach vulnerable people, especially mothers and children in remote area. Our country is small. It has 9 million population. And among this 9 million population, we have 93% mountainous region where people live in very difficult access geographical locations. So for urban population, we organized quite good access to still provide our activities toward reproductive health, family planning, and other activities where we're not paralyzed at all during COVID pandemic situation, and will be able to provide still the activity for mother and child care. And what is interesting, that at the same time providing good access for COVID treatment, including pregnant women and neonatal care, we were able to separate flow of the patients, more than 200,000 births per country, and all of them were lowest home delivery rate. So almost more than 95% delivery mothers has good access for deliver in hospitals, in obstetric care departments. And what we noticed during pandemic of COVID and mother mortality rate and neonatal mortality rate, they did not decrease, did not worsen. These indicators still were stable. It means healthcare system were able to provide good care for them. And of course, looking at difficulty geographical locations where for geographical reasons, we estimated that about more than 90% of population has good access within 1 hour till the reproductive and family medicine centers, ambulatory care. We, in our study, more than 4,000 COVID patients, we had about 120 deliveries among women who has COVID symptoms. Our strategy to separate these neonates from mothers, and mothers could have a good care isolated from children, and then they're again together within 2-3 weeks time. Of course, we don't have much experience on treating COVID patients, but we are interested to the same simple experience from other countries. Thank you very much.
Thank you very much, Mr. Gaffer, for sharing your country's experiences in maintaining a stable situation in providing health services for women and children. And also your analysis differentiates the urban areas and remote geographical areas. Thank you very much for that insight. And now let's move on to our next distinguished panelist. We'll have the honor to introduce Dr. Sanju Aladapo Faniran. Dr. Faniran is a Deputy Director in charge of Human Capital in the Social Development Department at the Ministry of Budget and National Planning of Nigeria. He coordinates the activities of all UN agencies in Nigeria on behalf of the ministry. In this capacity, he's also the partner country coordinator for Nigeria for the Partners in Population and Development, a 26-country intergovernmental body. Dr. Faniran's background is in demography and social statistics. So Dr. Faniran, the floor is yours.
Thank you very much for giving me the floor. So let me first of all appreciate UNICEF for nominating Nigeria and myself in particular to be part of this panel on behalf of Africa and Nigeria. So I also appreciate the organizer, the United Nations Office on Social Cooperation, UNFPA, and WHO, and as well as my organization, PPD. I mean, it's an organization to be proud of. Anytime, any day, I'm always ready for that. So don't let me, in order not to waste time, I just want to let us know that SDG provides the biggest platform to address reproductive, maternal and child health, even with the COVID and after COVID. It's like it's designed, SDG is designed to take notice of what may happen in future. And this is an opportunity for countries to leverage social cooperation, I mean, in addressing most of the issues related to reproductive health and sexual reproductive health, maternal child health care. Then in Nigeria, we have policies that addresses prevention of diseases relating to maternal child health care, and they also give approaches to appropriate communication to seek and deliver maternal child health care. Nigeria being having it as 7 states, that's 6 states, including the federal capital, as states that are autonomous. Some states during the COVID declared free health services for pregnant women for delivery of childbirth, delivery, and anything that has to do with maternal health care. I mean, it was delivered, it was given free to address so that it will not be a burden, I mean, in view of the ongoing pandemic. And then there is also an opportunity to do the diagnosis and treatment. And there's an ongoing bill in the National Assembly that is targeted at, that is tagged as infection prevention bill that will address mandatory tests and mandatory vaccination against any infection, including COVID-19, which is targeted at achieving the SDGs. Then I just want to leverage opportunities that we have, the post-COVID opportunities in social cooperation, because social cooperation will ultimately, I mean, bail out the world. But when countries come together, they think together, they work together, they collaborate, a lot of achievement can be made. In Nigeria, we have been using South-South network, South-South network opportunities in the membership of Partners in Population and Development, of which is National Task Force, to aggressively give special attention to reproductive health and maternal child health care, both during the COVID-19 and preparation for post-COVID, because the South-South cooperation, we have a network of about 15 MDs that are required, that are regarded as national task force to pursue that, so that the reproductive health, maternal child health care will not suffer, even both during and after the post-COVID. And then Nigeria is still optimistic that the MOU that was signed by PPD with UNFPA and United Nations Office on Social Cooperation to bring a political commitment express and technical expertise in the member countries to accelerate the implementation of ICPD program of action is still subsisting and still going to be held, I mean, withheld. Then Nigeria also encouraged UN agencies to reinforce their intervention in developing countries to improve health system through institutional and individual capacity building and sharing of best practices. And the countries, let me tell you that the countries of the South can share experiences using virtual technology on tackling COVID-19 and learn from good practices targeted at addressing COVID-19. South-South cooperation can achieve this, especially what we are doing, what is happening within PPD member country now. During the COVID, we've been communicating, we've been sharing experiences, we've been discussing issues that can address some of the targeted efforts on maternal and reproductive child health care. And then we can also encourage a peer review mechanism with a benchmark that can be initiated by PPD to access best practices among PPD and other related agencies, I mean the parent bodies that can access best practices among member countries of PPD as a step towards improving reproductive health and maternal child death, I mean, to achieve SDGs during the post-COVID era. And then we also encourage the stronger countries of the South to share COVID-related material with other countries whose economic strengths are weak, because that is what the strength that we have in the South Cooperation, and we have been enjoying it. We have been in PPD. A lot of support has been coming from a country like China and India and some other countries that are stronger than the weaker one within the alliance, and that has actually given an impetus to achievement of maternal sexual reproductive health in member countries. I also encourage that I want to suggest that best practices on strategic approach to tackling issues related to maternal child care can also be replicated among the countries of the South. Then the triangular link of the South cooperation can be scaled up by donors and development partners in support of countries of the South. And also, there can also be support to countries by the UN in strengthening their health system, starting from Nigeria and extended to other countries of the South to promote South-South and triangular cooperation. So I just want to mention a few requirements from UN to support countries in strengthening their health system, particularly reproductive and maternal newborn child health. Number one, there can be support to technology that enhances healthcare delivery services by UN. This is easy to be replicated among countries of the South, which include, number one, support to the development of a policy framework that addresses maternal and child health using technology. Then number two, support to capacity building from maternal and child health care providers, particularly on technologically enabled systems that promote social distancing, e.g. virtual training and conferencing. This one is easy by UN agencies coming together. Though we appreciate what they have been doing, UN agencies have been supporting Nigeria, they've been supporting other countries in various areas, but these are some of the initiatives that will actually promote the achievement of Agenda 2030 and the post-COVID era. I also encourage other countries to share experiences and work together collaboratively, I mean, within the ambit of South cooperation. Then UN can also support Digital Expo. Digital Expo is by supporting the establishment of digital exhibition center across major cities in the country and across major health and teaching institutions or facilities, because some of these places are training institutions. This can also encourage networking among countries of the South for peer learning arising from COVID-19 experience. The Digital Expo, which can be supported by UN, will ultimately enable the UN agencies, the United Nations generally, to manufacturers of relevant tools for reproductive, maternal, and newborn child health. It will also enable them to identify marketers of those tools in the country, I mean, various countries of the South, because it's a collaborative effort, which UN want to promote. Then scale up advocacy using radio for awareness creation. The UN can also support a national database that supports systematic coordination and systematic data flow in the health sector, particularly in Nigeria. And it can also go for some other countries within, I mean, in the South. Then this will modernize health information and replace the existing district health information system, which we have in Nigeria, that provide passive data that are not good for active decision making. No, data is very, very important if we really want to achieve the reproductive maternal healthcare. UN also need to conduct assessment of leadership and governance healthcare delivery system, I mean, among the southern countries, I mean, the countries within the South, so that they'll be able to enable, I mean, this will expose the profile, the accommodation, infrastructure, and equipment, technology, and personnel in the health sector. And this will facilitate effective efficiency, reliability, and accountability of delivery of results in the health sector by policymakers. What we are saying is that by virtue of what is obtainable or what is happening in developing countries, our policymakers needed to be tracked, they needed to be encouraged, they needed to be supported. So all this can be modeled for other countries in the South. Then there can also be support to National Logistic Master Plan to improve health logistic performance index for the country. These are some of the recommendations that these are some of the initiatives that we actually ginger countries to. Then the UN Office on SASA Cooperation should, as a matter of urgency, encourage and support an effective SASA cooperation as a collaborative system of achieving results across board. That is to achieve SDGs, during the post-COVID era. These are some of the issues that I considered, relevant and will go down the road for all members of the countries in the South, within the SASA Cooperation Alliance. So thank you very much for listening.
Thank you very much, Dr. Faniran.
Welcome.
Thank you for highlighting that South-South and triangular cooperation is to bring down the walls. And you have so many concrete ideas of how to bring down the walls, how to work together on various important topics. I'm so glad you mentioned the MOU that UN Office for South-South Cooperation and UNFPA signed with PPD. PPD itself is a demonstration of how countries can bring down walls working together on the common priority. And we are very happy to implement that MOU, working with you concretely on those topics you suggested. Thank you very much. And now let's move to our last but not least, our distinguished speaker, Mr. Hu Hongtao from China. Mr. Hu is advisor to the National Health Commission of China on South-South cooperation. He was also a former executive director of the Partners in Population and Development. With more than 30 years rich experience in population, health, and international cooperation, Mr. Hu has made remarkable contribution to the South-South cooperation in population and in reproductive health ever since ICPD in 1994. So, Mr. Hu, the floor is yours.
Thank you, Madam Chair. Dear colleagues and friends, based on the experiences of the past few months, I'd like to share with you my view on South-South cooperation and my expectation of UN agencies in the following 5 aspects in supporting southern countries to achieve maternal and child health and reproductive health related SDGs in the post-COVID-19. Some of the points already mentioned by the previous panelists. First, experience sharing. This is the essential and the fundamental elements for South-South cooperation. And in a global pandemic, its importance and the role should be more emphasized. As COVID-19 is totally a new disease, one of the biggest challenges we are facing is its uncertainty. Therefore, experience sharing among the developing countries is an important means to address COVID-19. We need to innovate our ways in this regard. In addition to the traditional in-person seminars, dialogues, and best practices, we should take advantage of the new technologies. For instance, the online webinars and workshops and social media like Facebook, Twitter, and WeChat. In the past 2 months, UNFPA, China National Health Commission, and the PPD Partners in Population and Development have successfully organized 2 thematic webinars on the maternal and child health in addressing the COVID-19. It was attended by a total of nearly 700 participants, and it is very well received. Second, technical guidance. We have experienced that in the past few months, we have received so much misinformation, which we have never experienced in our life before. UN agencies enjoy very good trust among the governments and their people in technical guidance and information provision. We encourage UN agencies to organize more researchers on maternal and child health and reproductive health in responding to the challenges of post-COVID-19. We very much appreciate that WHO, UNICEF, UNFPA, UN Office for South-South Cooperation and other UN agencies have supported a number of southern countries in developing technical guidance for MCH and IH in responding to COVID-19. The role of UN agencies in this regard could never be replaced by others. Third, capacity building. We have set 2030 SDGs and other internationally agreed goals. But what we need more is how to translate these goals into specific actions. We need more capable people for more effective implementation. COVID-19 is spreading beyond our imagination in many ways. The developing countries need to systematically upgrade their national capacity for MCH and reproductive health. The building and the development of more effective centers of excellence and the training of national focal persons on South-South cooperation is a cost-effective way to build a national capacity. We have many more to do in this regard. Fourth, partnerships. Disease respects no border. Facing this century pandemic, no country can win the battle alone. We need to work together, build partnerships, supporting multilateralism and international solidarity, so as to build a global community of health for all. Challenges are huge, and opportunities are also encouraging. At the Nairobi Summit on ICPD Plus 25 last November, 3 zero goals, including zero preventable maternal deaths by the year 2030, was reaffirmed, and nearly $10 billion were mobilized. Chinese government recently announced $2 billion international assistance for the next 2 years to support other countries, especially the developing countries, in their efforts in COVID response and the post-COVID economic and social development. Also, at the beginning of this year, UNFPA, PBD, and other international organizations successfully signed an agreement with Chinese South-South Cooperation Assistance Fund to implement innovative products on reducing maternal mortality in other developing countries. My fifth and last point is sustainable financing. COVID-19 is causing severe disruption and damage to the world economy, and it brings even larger financial gap in fulfilling the SDGs. Therefore, to ensure the sustainable financing for MCH and IH programs by the year 2030 remains very critical, and more innovations are needed for sustainable financing. Earlier this month, UNDP and the Chinese government jointly published China SDG Financial Taxonomy. Sorry, I cannot pronounce it correctly. TASONOMY, which provide a national guidance for inviting private investments and funding for achieving SDGs in China. This national SDG financial taxonomy, which is the first one in the world, and is very innovative initiative for South-South for SDG resource mobilization. It is my sincere expectation that the UN agencies make more efforts in assisting the southern countries to ensure the sustainable financing for accelerating the implementation of MCH and IH related SDGs, and make sure that no one is left behind at this difficult and a very critical time period of COVID-19. I thank you, Madam Chair.
Thank you very much, Mr. Hu. Thank you for sharing China's approaches and contributions towards international cooperation during this pandemic, and also for making very clear recommendations for UN. You hold a strong confidence, and rightly so, from UN's role in providing reliable information and supporting countries working together to research and providing technical guidance. You emphasized partnership, 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 and that's the solution for today's challenge and for the future. Thank you very much, Dr. Hu. Now we have heard from this distinguished panel a lot of concrete experiences and measures taken in countries to address this pandemic, but also to maintain the services to ensure women and children health. Also, we have heard their recommendations to you and their expectations and their understanding of how South-South and triangular cooperation can help countries working together on this. I see a lot of interaction from the participants. Now we have about 20 minutes for interaction. I'm lucky to have Martha from UNICEF to help me scanning through the questions. And Martha, would you like to share some of the questions and comments from the chat, or you would like me to do so?
Grace, please go ahead and ask the questions. We have 3 sets of questions at the moment. Would you like me to read them?
It's all right. Yeah, so I can get it from your message. Thank you very much, Martha. So the first batch of questions for the panel is, during this pandemic, countries with weak health services systems and have less enough PPEs, there's significant decline or postponed in utilization of ANC. Knowing the importance of this service, what is the best strategy or suggestion to increase the utilization rate in such countries under such situations? So this is one question, very technical, and I would like the panel to think if you would like to address this question, but also let me read out other questions so that we can address them in one go. Dr. Hu mentioned the sustainable financing is very important. So 2 other questions are related to funding. One question is from Nicaragua, with a sincere thank you, of course, to the organizers. And this is from Mr. Mark Canchel, advisor for maternal child health in PAHO, WHO, Nicaragua. The question related to mobilization of resources in the context of South-South cooperation. In our country, we're experiencing significant challenges mobilizing resources to address COVID-19 and at the same time, maternal child health, which is further exacerbating the health and economic consequences of the pandemic. One of the main reasons for this difficulty is due to funding restrictions from our traditional donor countries. So how would you address this challenge, and what are your advice from the panel? So maybe with this 2 questions, I can open the floor first, and then I will move on to another question. Oh, another one may be relevant, huh? You know, they are asking the panelists, whoever has experience with a strong diaspora program, working with diaspora groups or local civil society groups, they can act as fundraising and link to many donors. They're often looking for opportunities to help. Sometimes, you know, we also find that CSR offices of many local corporations and companies and development banks very helpful when you knock at the door. So any suggestions on that? There's also a question related to people with disabilities, and any countries can offer advice and examples of how they address the needs of people with disabilities. So let me stop here. This is a whole set of questions. I would like the panel, whoever would like to address those, raise the hand. Yes, Michelle. Thank you.
Yes. Hi, I want to answer the specific question for the diaspora, specifically for Suriname. Suriname, because in Suriname we have a diaspora that lives abroad that is almost as big as the population we have in Suriname, which is around 600,000 people. Yes, there has been a lot of support from diaspora abroad, but not only that, also from youth organizations and also the private sector in our country. There is this opportunity to harvest funding in countries and work together to respond for a COVID response at this moment. Because what we're seeing is that in Suriname we are still in the phase where we are strengthening people, economically, because a lot of people have lost their jobs, are dealing with big families, and how to provide in food and nutrition. And I want to just say that we need to include these youth organizations on the ground level that work in communities as pillars, because these young people or these people that work on a community basis know exactly what is happening in their community and who to identify and who needs the support. So you have a mechanism in place on a community level that can provide the support, and we should harvest that and facilitate that. But at the same time, we also have funding coming in from diaspora abroad. One thing that we have done as youth organizations in Suriname is that we have reached out to them, because we have people living in other countries, especially the Netherlands, because of the history we share, that are generous enough. And if you reach out to them and let them know that this is the situation, and that you have mechanism in place that can really identify and are reliable to really provide support on the ground, that they are willing to help. And there is also help from the private sector that is more so looking for underground support to help identify these vulnerable groups and help to provide just support in manpower. And to just bring those two elements together is very important and very needed in this time. So I think that's really great. And what we're also seeing is this intergeneration working together, because it's young people on the ground taking the initiative, but they're receiving the help from this older generation that is supporting in terms of finances, also in terms of knowledge and how to best tackle this issue. And just to see the coming together for me is a reminder of that we can get through this time together. And even post-COVID, or as was mentioned, even post-lockdown, that we can come through this unprecedented times together. Thank you, Grace. I hope that answers the question.
Yes, thank you very much. Yes, so do I see any hand raised for answering the first set of questions here? If not, I'm going to read out 3 more questions, and then I will ask the panelists one by one to have a couple of minutes. Oh, okay, Dr. Sahina. Yes, please, Dr. Sahina.
Actually, that was in reply to Mark's question. I raised the issue of looking into diaspora. However, he comes from a country where there are sanctions, and I wasn't able to answer. So this is the issue of the post-COVID. How do we deal with countries with Sudan is a country that still has sanctions and embargo from the United States, and I think that they can tap into other countries that, for example, the European Union and so on and so forth, where there are emergency funds. I just wanted to tell them that there are emergency funds from certain organizations that can actually, for countries that have sanctions. We have a similar experience as Nicaragua, because we're also sanctioned right now, and there are economic embargoes on the Sudan. But we've been able to receive a lot of funds.
Thank you very much, Dr. Sahina. So I see colleagues now. I see unmuted. Dr. Hu, are you? I see you unmuted yourself. Are you going to address some of the questions? Actually, there is.
Yes.
Yes, please.
Yes. Can you hear me?
Very clear.
Okay. And I want to say a few a few words in responding to respond the question about financial resource mobilization issue. And I should be very honest that this is a very difficult question. But as I said in my intervention, that the challenges are huge and the opportunities are still there. And I think there were several new ways to have more resource mobilization. And I think we can also, in addition to the traditional ODA, that we can also looking forward to the emerging economies countries like China, India, South Africa, Brazil, and others. So, for instance, China just 2 years ago, I think in 2018, established China South-South Cooperation Assistance Fund. And also in the year 2018 also established the China International Development Cooperation Agency. This is a new thing because usually we thought that developing countries do not have this kind of facilities, agencies. But China is one of the few developing countries have established this kind of agency for promote the for promoting the South-South cooperation. In the resource mobilization, I think China just several years ago announced that for the South-South Cooperation Assistance Fund, the first group of money is $2 billion. And that's of course in the international community, maybe this is not a big amount, but for South-South cooperation, that is a big amount of money. And also just earlier this month, the Chinese President Xi Jinping also announced $2 billion assistance fund for addressing COVID-19. So the opportunities are there. For China, I think it can approach the Chinese South-South Cooperation Fund through the Chinese embassies. There's a commercial office in Chinese embassies, and you can approach for the opportunities. There were two things I think I like to emphasize in the resource mobilization. One is that innovation. So we cannot do business as usual. Innovation, always try to find something new, find something special to attract your donors. So that is very important according to our experience in the past in promoting the South-South cooperation. The second thing I want to emphasize in the resource mobilization, we need to emphasize two factors. One is technical factors. That is, we need to have a certain skill to write good proposals. And the other factor is also very important. That is a human factor also, that you have to keep a good relationship with the donors, with donor agencies. So the hopes are still there and challenges are big. This is my response. Thank you.
Thank you very much, Dr. Hu. Now let me read out 3 other questions, and to conclude the question and answer session, I would invite the panelists again, whoever would like to address those questions, or especially, you can just unmute yourself when you're happy to address any of the questions. The first one is, in your respective countries, do you have data on the % reduction in access to MCH services, maternal and child health services, due to COVID-19? This is a question from Vic Gelano from Philippines. I heard from Tajikistan some of the data shared, but other countries, if you have data on the reduction, yeah, that would be important to share for this participant. Another question is about, yes, we talk about South-South cooperation and international partnership. how can countries be supported to be self-sustainable in the production of PPEs, drugs, supplies, and expertise to address this and future pandemics? So that is the second question. The third one is directly on South-South cooperation, asking, I think, maybe Mr. Chadiak is still here. Will UNOSSC take up the recommendations by Dr. Van Nieren, Dr. Hu, and others on those concrete elements that can advance South-South cooperation with partners? A related one is how the organizers, UN Office for South-South, UNFPA, UNICEF, WHO, PAHO, come together to support the global organizations, those are promoting South-South cooperation in developing countries to improve maternal and child health and to respond to post-COVID-19, which is very important as it disrupted the whole health system in developing countries. So these are the last three questions. I know there are other comments and questions participants may have. We would not be able to exhaust all of them, but this summarizes the key questions so far. Okay, so shall we, any participants who would like to address any of the questions? I was wondering, Mr. Medina, you have anything to add from your side? Yes, please.
Thank you. We have seen how South-South and triangular cooperation has continued to increase in magnitude and scope in this the region of America, particularly in the health sector. In this new context post-COVID, our capacity to quickly adapt to new challenges is paramount. That entails staying up to date with the new evidence, guidance, procedure, best practice, and lesson learned. We believe that a key are where the UN system can support member states in leveraging South-South and triangular cooperation, both from the offer and the demand sides, is to eliminate the barrier to this change, which can come in a variety of manners. Just to name a few, the need for a global perspective. We may be only focusing on what our neighbor and hemisphere partners are doing, but the challenges are global. With the support of the UN, we can overcome challenges such as language systematization of lesson learning and best practice, strategic partnership and investment. In a context where we will see our economies challenging by the impact of the pandemic, we must all seek to achieve for the best value for our money. In that sense, South-South and triangular cooperation can help us achieve that objective by identifying best practice and the key success factor for the successful and sustainable implementation of public policy. Another one is involving cooperation of the leverage of South-South and triangular cooperation in strengthening a health system in developing countries is necessary to reach knowledge, technical assistance, and investment. Today, more than ever, cooperation moves away from the paradigm of one way, assistance from donor to recipient, toward a model where the emphasis in the firmly placed on capacity building, self-rename, and the sustainable development of the countries. We need to learn from other countries to adapt their achievement to our own context. I would like to, I'm finished. I would like to thanks again for the organizer for the covering this webinar of such critical issues that will change the development progress of the nation in the years to come. We stand ready to work with the UNS system and member states to accelerate the progress to achieve the SDGs. Thank you.
Thank you very much, sir. Thank you. So before I ask maybe Mr. Chadiak to answer the questions about how UN office would take up the recommendations working with partners, may I also ask partner agencies if you would like to pick up any of the questions relating to our collaboration?
Hi, Grace. I wanted to answer one specific question. I don't know if there's time for it.
Oh, Michelle, yes, please. Maybe a very brief one. 1 minute. Thank you, Michelle.
The question of the data on the % of reduction in access to maternal child health services. So one thing we need to work on as a Caribbean, as a region, Latin America and the Caribbean, is collecting data. We've seen in the past that this has been an issue. And no, we don't have the data yet, but we can say that, you know, there has definitely been a reduction because even before the pandemic, this was an issue. And now the pandemic is something, you know, we've never seen before, and it's a developing situation. We're still in the phase of putting mechanism in place, or, you know, COVID measures into place on how to still provide these services. So this is also, you know, a call and a moment to see that we need to, this is one of the weaknesses that we've seen, that we need to work on our data collection to have an even quicker response on the reduction of the services, and to have a plan in place. Thank you.
Thank you very much, Michelle. So now, if I don't see colleagues from agencies would like to address the question, maybe Mr. Chadiak, the question on South-South and on our office collaborating with other UN agencies.
Thank you very much, Grace. Our office is, by definition, a UN office. It works for the whole United Nations system. And one of the mandates that member states generated in last year's South-South conference in Buenos Aires was the request for the United Nations system to have a coordinated strategy to support South-South and triangular cooperation. This is necessary because, after all, the UN system was created with the idea of, with the parameter of North-South cooperation. So South-South cooperation has expanded, and the three agencies that are joining us today are a model of how to do it. But the idea is, by the end of this year, we will have a United Nations strategy approved by the Secretary General and all the UN agency heads, and also an implementation plan to go beyond just a political declaration and really undertake actions. Regarding the specific proposals and supports that the office can make, one is the knowledge. The idea, we already heard very valuable experiences today, and you can use our platform, Galaxy, South Galaxy, the logo and the link is in the back of Grace's image. That is not just a knowledge sharing space, but also a partnership creating space. So the idea is that we have already 20 UN agencies and over 300 partners participating in Galaxy. So join Galaxy, utilize it to share your knowledge and also to learn from others and to develop partnerships. Also, we're mobilizing knowledge from the Global South through our network of think tanks, a joint initiative with UNDP that is producing tailored knowledge to the different issues. It is already produced a great quantity of material, and every year we're going to produce more. And also we are providing funding. We have mobilized resources. The largest one at this stage is the India UN Development Fund that has provided funding of about $45 million over the last 2 years to finance South-South cooperation initiatives, all of them implemented by the UN system. So our office is totally committed, and we look forward to working with our other sister agencies and with you as Southern actors to facilitate your sharing of knowledge, your partnering, and the mobilization of resources. Thank you very much.
Thank you, Mr. Chediak. Now we're good on time. Let me quickly wrap up. Again, the UN agencies are so collaborative, and they try to give the stage to all the distinguished speakers and invite us to summarize on their behalf. It's such an honor and pleasure to work with these agencies. So I have heard from the distinguished panelists and some comments from the chat box emphasizing the importance of the issue of maternal and child health, especially among this pandemic. And we are warned not to create a pandemic within a pandemic. And that requires countries to take concrete measures to address this challenge together. And we have heard experiences from multiple countries in addressing that by separating patient flows, by assessing differently needs from communities in urban, rural, and remote areas. And we have heard concrete measures of how to make sure those services are accessible now and more accessible in the future. This is the first set of comments about the importance of this issue. Secondly, we have heard very strong and clear recommendation for UN to really perform to its full potential the role as a convener, as a knowledge facilitator. And how to do that? The expectation is from UN to support analysis of impact with differentiated lens of groups and areas and communities, and to support providing reliable information based on scientific research, forming technical guidance for countries, and also prioritization to not only engage youth, women, children, but actually put their priorities up front in the whole process. And we have heard the expectation of UN working with countries to ensure health system is not isolated. It relates to also support in education sector, in technology, especially today in addressing digital divide, in supporting digital innovation and infrastructure. And also the UN agencies, specific agencies bring their expertise, which are deeply appreciated by the speakers, but also there's a voice of UN continuing to perform a better One UN approach. This webinar as a collaborative approach of several UN entities is an example, and we will continue to do so in the future. The third set of comments and reactions are on South-South cooperation. I think we all have this consensus that Cooperation is very needed today, and partnership is the solution. I'm so glad that partners and participants are holding a very progressive and optimistic view, hold confidence in South-South and triangular cooperation to bring down walls and to build stronger solidarity among countries. But we also heard there are practical challenges in terms of financing, in terms of cross-border management, and in terms of bring down the barriers of sectors to work together. So that tells us that we need to put in more efforts in South-South cooperation. There are promising opportunities through regional cooperation, neighborhood countries, through working with international organizations who has a true interest in promoting countries working together, such as PPD and others. And knowledge is the key in South-South cooperation. There are many concrete topics suggested for knowledge sharing, including on economic, social front, as well as on health system, education, digital, and also building on knowledge. We're talking about South-South cooperation in supporting policy coordination and capacity development, networking, adapting solutions, not just exporting, importing solutions, adapting to local context. So all in all, we have a very resourceful panel and a very interactive discussion. I thank you all very much, but in particular, I would like to thank the colleagues who have put this together. So this actually, I'm looking at our colleagues from UNFPA, Yan Minlin and his team, Bobby, Russell. I'm talking about UNICEF, Marta Santos, and also from PAHO, WHO, Carlos, Emmanuel, and all your teams. And from UNOSSC, we have Shams, we have Navita, we have the team working with us. So thank you very much, colleagues, for making this such a smooth dialogue. And I hope to see you again in the series of webinars we organize on COVID-19 and post-COVID-19. As Michelle said, I advocate together with her that yes, we're in a challenging period of time, but we can return stronger. Thank you very much, colleagues. Bye.
Bye-bye, guys.
Bye-bye.